These people have just arrived from South Sudan. They've been walking for weeks, fleeing from persecution and food shortages back home. Though they may feel safer here in Pagak Transit Centre, if the level of aid does not dramatically increase, they'll be no better off this side of the border.
The camps where people are being moved to have not got much infrastructure. There is poor shelter, poor water supply, and almost no sanitation. So the new arrivals are being shifted into camps that are congested and overcrowded with relatively poor conditions.
Lekta camp, originally designed for 20,000, now hosts 40,000 refugees, and that number increases daily. MSF is working in Pagak Transit Centre and the two permanent camps, Lekta and Itang. Medical staff provide outpatient and inpatient care and vaccinate children against measles upon arrival. But these measures simply aren't enough.
There is an outbreak of measles currently ongoing in the transit centre and in the refugee camps. There is malnutrition rates up to 20% of global acute malnutrition and 7% of severe acute malnutrition. That is a recipe for very bad health outcomes, and we're seeing high levels of mortality in our health centres, and emergency mortality rates are above the normal threshold.
Already considered critical by the teams working there, the situation in Ethiopia is set to get worse in the coming weeks. The number of refugees is estimated to reach 150,000, and without an increase in humanitarian aid, conditions will only get worse when the seasonal rains destroy shelters and increase the risk of disease.